recognize the clinical signs of common upper and lower respiratory disorder in horses, understand the pathophysiology and etiology of respiratory disease such as raw, IED, and strangle, learn diagnostic technique including auscultation, endoscopy, imaging, and lab tests, develop treatment and prevention strategies for acute and chronic inflammatory airway disease, recurrent airway obstruction. Recurrent airway obstruction, similar to asthma, triggered by dust, mold in the hay. Inflammatory airway disease affect young performance horses. Signs include chronic cough and exercise intolerance, strangle caused by Streptococcus equi present with lymph node abscess and nasal discharge. Viral respiratory infections such as equine influenza, herpes virus 1 and 4, pneumonia, pleuropneumonia, often in full or following stress. Diagnostic approach, clinical signs and auscultation, crackle, wheezel, endoscopy to assess nasal passage, pharynx, larynx, trachea, transtracheal wash or bronchoalveolar lavage for cytology and culture, radiograph or ultrasound for lower airway lung pathway, PCR or culture for detecting infectious agent. Treatment and management strategies, environmental modification, dust-free bedding, soaked hay, bronchodilator, corticosteroid, inhaled or systemic for REO or IED, antibiotic for bacterial infections such as strangle, vaccination protocol for influenza and EHV, supportive care, rest, rehydration, non-steroidal anti-inflammatory. A 7 years old warm blood gelding used in dressage. Chief complaint, chronic cough during exercise, nasal discharge for 3 weeks. Clinical finding, mild fever, bilateral nasal discharge, crackle on lung, auscultation, endoscopy, mild tracheal mucus. Cytology, bowel cytology, neurophilic inflammation, PCR negative for equine influenza or herpes virus. Discussion, what is the most likely diagnosis based on finding? What environmental changes would be beneficial? What pharmacological treatment are recommended? Likely inflammatory airway diseases, improve ventilation, turn out time, use silage or soaked hay to reduce dust. Corticosteroid, dexamethasone or inhaled fluticasone, bronchodilator if needed. What's the common cause of REO in horses? Viral infection, mold, hay, dental disease, parasite. Mold, hay. Which test is most appropriate for evaluating lower airway inflammation? Nasal swab, blood culture, bronchoalveolar lavage, fecal exam, bronchoalveolar lavage. Strangle is caused by which organism? Streptococci, Rhodococcus equi, EHV1, Aspergillus, Streptococcus equi. Which of the following is not a typical treatment for REO? Corticosteroid, bronchodilator, antibiotic, dust control, antibiotic. What respiratory sound is often heard in lower airway